Ken Sim, Nurse Next Door, thank you for joining me. These are interesting and very challenging times for business owners because for all of us, not only do we have to keep our business open, we have to think about our relationships, especially with our own staff, but our clients, in your case, your patients, suppliers, and so on. How is this crisis affecting you right at the moment?
It's really interesting. So we actually have two businesses. One, we have a home health care company, and we take care of people's parents in their own homes. And so, from that perspective, it's been very trying. But at the same time, we've been through this process before with H1N1, SARS, what have you. So, you know, our business, it's great, and it's really fulfilling in the sense that we know that for every person that we keep at home, we're literally saving lives, because if a senior can't stay in their home, they end up in a long-term care facility or a hospital, and the risk of getting COVID-19 increases, and they're at an at-risk population. So from that perspective, we're good. It's been, it's challenging because it's a challenging environment. On the other side of business, we have a bunch of bagel stores, and it's been incredibly challenging. It was challenging before this crisis for a whole bunch of reasons, due to, let's say, the economy and sort of government policies. I don't want to get into that because I don't think now is the time for it. But needless to say, it's been tough, and this is if we don't deal with this issue sooner rather than later, there will be a lot of businesses that go out of business after we're all said and done here.
Oh, with your bagel business, you're in the food service business, and the
That's right.
restrictions have literally shut you down, haven't they?
Uh, a little bit. So we're still an essential service. So we have sit down, but we also are grocery, and so we got ahead of it quite a while ago. Like, we were all on social distancing, what have you, restricting people coming to our stores, and we practice food safe and a bunch of other procedures that we learned through Nurse Next Door. So we aren't, let's say, a bar where they had to shut down. That being said, our businesses, like, people aren't coming in, and
Hmm.
you, there are ghost towns on all these high streets, despite the fact that people still can come in.
With your shops, how many shops do you have? How many people do you have working there?
We have five shops, and we have over 100 people working with us.
Do you have them all still on staff, or is it on? Have you had to let some go? Or are you in a wait and see pattern at the moment?
Well, right now we haven't let anyone go, and our people are like family, and so we're doing everything we can to make sure that you know we defer that decision as much as possible. And we're fortunate because we have another company called Nurse Next Door that can help us weather this storm. But I've spoken to a lot of other business owners that run restaurants, and they are freaking out. No one plans to. Uh, you never plan to run your business without maybe not having any revenue whatsoever for 3 months, let alone a year. And that's what all our businesses are facing right now. In fact, there's one person that I spoke to. He runs a train company, and he's planning to have no revenue for 18 months. Um,
Eh,
they never planned for that. Like, you're never, no one has ever run a business case scenario where you had to maintain your business for 18 months without having any revenue.
Wow. Did you wind up diversifying to protect against situations like this in the past? Is that what led you to wind up having two different streams of revenue?
No, obviously that was a nice little benefit, but the first business we started, Nurse Next Door, that was based on personal experience. My wife went on emergency bed rest, and we had some pretty, interesting experiences trying to hire a caregiver. Actually, quite terrifying. And so we put two and two together, and we launched our business back in 2001. The bagel business, we just had some friends that ran a bagel shop, and we love them and we love the product, and we thought it would be great to launch a new venture together.
Mm. So it just happened to work out because there
It
are other
just so happened
companies.
to work.
Yeah, there are other companies that I know that went through tough times back in the 80s and went,
Mhm.
okay, that's it. We are not going to be in a single business any longer. We're going to diversify. And we're going to diversify so that we're in quite a completely different field. And as you can see right now, for you, that helps to ensure the survival of one of your businesses because the other one is remaining strong. As a matter of fact, it may be actually be in more demand as a result of the current situation.
Yeah, look, we just want to get through this process, the situation, because at the end of the day, it's affecting the entire world, and we all have a vested interest in making sure that as many people, survive this as possible. And yeah, it will, our business will be stronger, and there will be a lot more awareness around home healthcare and why you may want to keep your loved ones at home versus going into a long-term care facility or a hospital. By the way, and that's not a knock on a long-term care facility or hospital. They do amazing work and they're caring people in great organizations. It's just, when you increase the number of people that come into any, place, you just increase your risk of infection. And so that's the other great thing that's going to come out of this going forward, that all of our institutions and our people will understand, the importance of personal hygiene, and that's gonna be great no matter if you're in a long-term care facility or a hospital or a restaurant, which I think is phenomenal.
As far as Nurse Next Door, are you in a position because of the demands on healthcare workers right now where you could actually take on new patients or clients? Or are you in a situation where you have to restrict being able to bring new people into the envelope of your services?
No, we don't have to restrict. And, the one thing we learned from our previous experience with SARS and H1N1 is, personal hygiene is super important. And then we look to the guidance of the experts. So our provincial health authorities, depending on the province we're in, or the state authorities, or, in Australia, they have their own programs going on there. So we always defer to what the current guidelines are, and they're ever evolving. Um, that being said, we've actually had requests from a bunch of long-term care facilities where people are refusing to go to work because they're scared to go in, and so we educate our people and we protect our people. I will never personally put anyone in a situation that I was not willing to go into myself,
Hmm.
and so that's the underlying rule. But we inform ourselves with a lot of information, and we have a lot of support for our people, and I think it's really important in times like this um, that we protect our most vulnerable, and we need to step up and go and help our seniors in the long-term care facilities or at their homes. Just like we have a responsibility, it doesn't matter if you're 13 or 57. Social distancing is really important. Like a 13-year-old would be at incredibly low risk of something serious happening to them, but they can infect someone who's 84, and you can actually kill someone. And so we all have a responsibility to step up, no matter in whatever fashion, to help out the community for the better good.
Now, you have a sense of civil duty. You have put your name out there into the political arena in the past. In situations like this, we all have to look to the government for some kind of guidance. But as business people, what is it that you're looking for from government to help ensure that we can all navigate our way through this crisis?
That's a great question. And before I answer that question, I do want to say that I do believe that our current, civic, provincial, and our federal governments, they are doing the best they can do, and they're actually doing some really great things. And
Hmm.
in times like this, I think we all have to strip away what political affiliations we have, and we all have to step up together. And so I'm a big supporter of our current council and mayor and our premier and our prime minister and everyone in between. And so I just wanted to get that out there.
All
Um,
right.
and so I think what our when I look at our city government and our provincial government, what they've done really really well is they've listened to the experts, and so they've listened to our provincial health authorities, and they are taking guidance from them. The next shoe to drop will be once we get through this, and we will get through this. Our businesses are under siege, and over 99% of people in this province are employed by small and medium sized businesses. And so if we don't do something to support our businesses, we're in a lot of trouble. And we're living in an unprecedented time. So if you're to answer your question now, I think there's three things. At the civic level, I think we have to revisit our entire budget. Just like any other company has done in the last 9 days, we have to say the budget that we had that we're about to approve is completely irrelevant. And we need to compartmentalize everything into must-haves and nice-to-haves. And a must-have could be, you know what, we have to make sure that we continue this fight against COVID-19. Absolutely, we should be focused on that. An example of a nice-to-have, the conversation around the Granville Street Bridge. Look, I'm not for it or against it. What I'm saying is that is a nice to have. If investing in the Granville Street Bridge comes at the cost of all of our businesses going out of business and we don't have any jobs or community, I can tell you where I stand on that one very quickly. Okay, so that's what the civic government can do. The provincial government, I do want to applaud the fact that they've accelerated. They basically eliminated the wait times for MSP, so anyone qualifies for MSP. I think that's very smart. What they could do better is rethinking the way they impose the employer health tax. The health tax, how it's being charged, isn't based on ability to pay. It's just based on the number of employees you have and how much you have in payroll. And you can have a large organization with a lot of employees in payroll and not be profitable. And all the employer health tax does is actually it accelerates your demise. And so there are different ways of structuring it where you don't have to impose it on people that don't have the ability to pay. And we can get back to a progressive tax system there. And that's a longer conversation, but that's something I think we really have to visit, because speaking to a lot of business owners and from my own personal experience, it has been a really tough one to swallow, and it actually hurts businesses big time. And then on the federal side, I do want to applaud them with what they did with EI, eliminating wait periods and being a lot more flexible in terms of who qualifies. I think that's great. What we need to do is we need to realize that businesses, they don't have that same luxury. So even if we shut down our businesses, we still have to pay rent and we have a bunch of expenses. And if those go on for 3 to 6 months, we are out of business. And so the EI was great and we took care of people, which I'm a big supporter of. But guess what? In 14 weeks, there's nothing to go back to. And so something like a federal rent abatement program, which I know is a pretty bold ask, but if the feds step up and they say, look, we will cover the rent, we'll issue a bunch of bonds or whatever, however they decide to do it, and we will cover the rent for all these different businesses for 3 months. Consider it an investment. It may take 10 or 50 years to pay it back, but we will have a strong business community. The alternative is there's nothing left, and then we are going to spend even more money on social programs to take care of people that don't have work.
So as I listen to you, I agree with you. I think everything that you're saying is absolutely spot on. But I also wonder whether or not all levels of government can say, we're going to forego mandatory tax payments. You know what it's like especially as a small business. The 15th of the month comes around and you've got your employee remittance, or you've got your GST, sure, or your provincial sales tax returns. They don't, as a rule, care whether or not you've got revenue or not. All they say is, you build it, you owe it to us, pay us and pay us now. Sure. And I think a great gesture from governments would be to say, we are foregoing that requirement, and you will not be penalized because you don't make that payment now. Make it up in the long term. It's a way of not having to go through an arduous process of saying, here, I'm going to apply for this. Somebody has to determine whether or not you're eligible for it. And the next thing you know, it's 12, 14 weeks at a minimum, if not longer, before you get the answer, and you're still out of business. Whereas being able to maybe hang on to that money could have got you through a few extra weeks, allowed for revenue to start to flow again, and maybe you can keep the wheels turning. But it takes a little bit of insight and understanding from government officials to instruct their tax departments to function that way, because I don't think a lot of politicians even know that that's how it works.
Yeah. No,
that's my statement. It's not even a question.
No, I think you're bang on. And so, Yeah, the timing is onerous and the payments are onerous as well. And once again, it goes back to ability to pay. I give this stat quite often, and people are always shocked. And even like people that have been in business for 30, 40 years, um, for every dollar that we could pay our shareholders in an after-tax dividend, we generate over $100 in direct and indirect taxes. It's not a percentage, it is a multiple. You have GST, HST, you have all the payroll taxes, EI, CPP, WCB, and all these other embedded taxes in there. And so that's not a complaint. I think we live in a great country, but what we have to realize is we don't support our businesses and do some of the smart things that you just mentioned. For example, we can put these businesses under, and there's no such thing as government revenue. It's all taxpayer revenue, and if you kill the taxpayers, be it the business, guess what? We lose our social programs. We lose our schools, we lose our roads, and these are unprecedented times right now. I don't think people realize how precarious it is.
You know, as you were explaining how what um, the relationship is between shareholder payout versus what the taxes are that are generated, it made me realize, you know, governments are your partner when you're in business. But they don't seem to think of us that way, as though we're in partnership. And to get through something like this, that's the mindset that I think that we have to have. That all levels of government and all of your customers, your suppliers, your team members, your staff, we all have to look at this as though we are partners and we're trying to figure out ways to get through it. And sometimes it means being
Absolutely.
creative, other times being flexible.
Yeah, and you know what? I think if our politicians listen, look, we have a lot of great people out there with a lot of great ideas who are willing to step up. If they let people step up, like they have with dealing with the COVID-19 crisis, and they've listened to the medical professionals, if they do the same thing and they bring in people from the business community to come and help out and give advice, I think we will be very well served. It's not going to be easy, but we have a higher probability of a way better outcome.
So, what are the most pressing issues for you here in the next couple of weeks as we continue to see how this will unfold before we even understand where the floor might be?
Yeah. Well, I'm a little biased in the sense that even though our businesses are very important, um, we need to solve this COVID-19 crisis. And because we're on the front lines as well, um, we just want to, we want to do our part in saving lives. Everything else is just, it's, we'll deal with that stuff later. It's not about money or whatever. We're fortunate, we've always made sure that we could weather a bunch of storms, so we will be fine on the nurse next door side. And so our primary concern is making sure we take care of our customers or patients, whatever you want to call them, and our people. Our people, they have mortgages to pay or rent to pay and groceries to buy, and we don't want to lay anyone off. It's hard, and bring the human aspect into it. Um, that's important to us, and we'll get through this. Um,
Yeah,
but we just have to
yeah, you
figure out
touch
how.
on it. You touch on an interesting point there. You know, your people are your responsibility in a very important way, and it weighs on you. You're making decisions that affect them, and so you want to make sure that you make good decisions.
Absolutely, absolutely. And so my story. My parents immigrated here in '67. I was born in 1970. There were five kids. I went to five elementary schools in 7 years, not because we were flipping real estate, it's because we couldn't make rent.
Hmm.
So I know what it feels like. I know what it's like when your mom comes home and she's worried, um, as an example. And so, yeah, we're going to take care of our people. We'll make sure we take care of our people as much as we can. It's super important because the effect that it has on so many lives, it's amazing.
Well, I wish you great success for your entire team, and of course for the people that you're serving, because everybody's well-being is at stake here. And I thank you for taking the time to come and share with us some of your insights, your thoughts about what government can do, and then what we all need to do to make sure that we address this healthcare challenge. Thanks
Great. Well,
again.
thank you very much for your time.
Great.
Take care.
You too.